Welcome to this slit lamp examination video in which we'll go through a video of the posterior segment. This is a patient who had a vitrectomy, and this is a siliconized eyeball in which you're seeing through a 90 diopter lens. You're seeing the posterior pole with a cup to disc ratio of this is a patient which you're seeing at a lower magnification, so seems to be a cup to disc ratio about 0.6 on this side. The important thing which you want to see in patients with siliconized eyeball is if they're younger patients, you'll see that sheen from the retina pretty easily, but sometime in this patient it's not very evident that silicone oil, especially on this video, but when you're looking through that slit lamp, you will get that sheen. Here you can see, if you look at that area, this is area which you can see that sparkle of light coming back from that reflection from the cornea, and you see similar sort of thing when you're moving around with the slit. And the other thing, important thing, whenever you think it's a siliconized and you are in doubt, what you want to ask the patient is to look down and you want to see that meniscus of silicone oil. This is a pseudophakic patient. Here you can see this is the rim of the rhexis which you're seeing in this patient, and you ask the patient to look down and you will definitely see that meniscus. So in order to demonstrate that, I'm going to show you this. This is very nicely shown over here. So here you can see this is the meniscus, inferior meniscus of the silicone oil, because if you see the eye like this, if this is the eyeball and if you have got the silicone oil present in this area, so the silicone oil is, there's going to be a space between the, if there's not 100% fill, there's going to be a space between the oil and the inferior retina, and this is what you're seeing over here. So this is the inferior meniscus of the, I'll just clear this again. So this is actually the meniscus inferior, this is the inferior meniscus because it's giving you a double shade as well. The reason and this is the peripheral retina which you're seeing. What happens is when you're looking at that inferior meniscus, you see a reflection of the peripheral retina, and that gives you another appearance over here. That's what was confusing me as well while demonstrating you. But this is the meniscus, so you ask the patient to keep looking down and you identify that meniscus and keep moving around, and you will see this meniscus is definitely present. And here you can see this, and here you can see the inferior edge. And this is the retina which you're seeing in between in the slit lamp examination. This is the area of the retina which you see without the silicone oil, while this is the area of the retina which you're seeing through the silicone oil. So you can see the difference between these two areas, which is important to highlight. And sometimes you have difficulty in finding that area and you miss that out. But this is a typical fill of about 90% that you can see. And when you're moving that eye, you can see that meniscus move as well. So this is an important finding which you need to pick up in patients with siliconized eye. And then obviously you ask the patient to look in different direction and you can see retinal laser marks. Thank you very much for watching.